So this is the Aladdin. For the Aladdin, it's pretty straightforward, but this machine's very touchy. So I'm gonna again punch in Robin's information. I think for the Aladdin, you go date. You said 29th January?
21st.
21st, sorry, my bad. And then first, and then 2002. And then you also punch in the ID, which is the health card number, so I'm just gonna put in whatever here. And she's a female, so okay. And then it brings you to this screen, so it's always phakic lens that we're going with. It's always phakic, it's always selected, so all you have to do is hit OK. And then I'm gonna get Robin to place her chin on the chin rest again, make sure it's level, hide it again. So this machine's pretty harsh on the eyes because it's very bright. So you try to do it as quickly as possible, but making sure that the patient doesn't move much. So I'm gonna make sure it's very clear and it's in the center. So red means that you're too far away from the patient, and blue means that you're too close to the patient. So if you saw that, that's blue, that means you're too close to the patient, and green is what you're basically aiming for. So I'm gonna try to get the green. Again, Robin's a pretty good patient here because she's not moving, but this machine is very sensitive to touch. So you have to make sure that the patient isn't moving much or moving their eyeballs, and they have their eyes wide open. So if you look here again, you want to get all these numbers right. So we didn't get the ACD and the LT value, which means we're gonna repeat again. And let's say the second time when we do it again, we get these two numbers and we didn't get any of those. That's fine, as long as we've got like a right number in one of the spots. That's what we're looking for. So the machine's, there you go. So it's clear and it's in the green box, so it should work this time. But don't be fooled by it. Okay, so again, these yellow basically means that it's an error. So we're just gonna try it once again. For Aladdin, we basically try 3 to 4 times. If it doesn't work, then we go get some help. Because again, this machine's very harsh on the eyes. Okay, so this is basically what we're looking for, that we get all the numbers right. Even if, let's say, we were missing a couple, but as long as we've got these white numbers in one of the boxes, we're fine. So now you pull back the machine, move on to the other eye. And again, red means I'm too far away, so I'm gonna push it closer, but not too close, because now I'm in the blue zone. There you go, that's green. And that's what we want, so it's all good. You can sit back, Robin. So now we go to IOL calculation, and here we make sure that's the right doctor. So we selected Dr. Durjan first, so we'll do that again. So I'm gonna hit on Dr. Durjan's name right there, and then you go Barrett, Universal 2 formula, and I'm gonna make sure that this sometimes happens. As long as we've got all the values, you just hit save. So it brings up everything for the right eye as well. So we hit Barrett, Universal 2 formula, and then print. So Barrett Universal 2, print. So once it finishes or starts printing, you're gonna see this dialog box. So hit yes, because you wanna save it. Not many times people forget, but if you ever come to use this machine and you see that dialog box, always hit save, just in case somebody forgot. And then it prints 2 copies. They're essentially the same values, but just to make sure you get the right one, I think we need to replace them. And I think that's about it for this
Any
machine.
troubleshooting or anything?
Again, when you see patients that are moving, because again, as I mentioned, this machine is very sensitive to touch. If patients with Parkinson's or opaque, very opaque cataracts come, then you're going to have a lot of issues. So you try your best. Try the drops again if their eyes are getting dry, and try a couple of times. If you can't get it, get one of the senior staff members, and then if absolutely you can't get it, as long as you've got that and the ultrasound, you should be fine.